have the blueprint should be done maybe tomorrow, not tomorrow after class.
That's Tuesday.
That's the last lecture. Thank you. Yes. Okay, have y'all talked about soft tissue injury in previous classes? Rice therapy, rest, ice, compression, elevation, when there's a sprain or a strain?
Very slightly.
Yes.
Okay, so anytime there's like an ankle or a knee sprain or a wrist or elbow, obviously we may need to do an x-ray, but an x-ray is not going to pick up on any soft tissue damage, only bones, right? So x-ray is done. If there's no breakage, no fracture, we're going to go ahead and just treat the soft tissue with elevation, rest, obviously, compression. Don't wear compression stockings and ace bandages at nighttime, though. Make sure you take them off so it has a chance to, you don't want that fluid staying down in that area ongoing 24 hours a day. So check those ace bandages. Elevate ibuprofen, you're going to get more relief because it's an anti-inflammatory versus plain Tylenol, which I, in my opinion, think does nothing. Tylenol doesn't work. Definitely for when you need anti-inflammatory effects, you need that ibuprofen. All that y'all can kind of look at. Make sure to review all the different types of fractures. They're in your textbook. Compound, green stick, simple. What are the differences? What makes one and one the other? Okay, make sure y'all review that. Spiral fracture, what is that? Twist. In pediatrics, we see spiral fracture. I'm kind of concerned about that. That might be intentional. Not always, but think about that too. Traction. We're going to talk a little bit about that. First important thing, if somebody is in traction in their bed, make sure they're in right alignment because alignment is crucial for the counter traction and the traction to actually work. So we always want to assess the alignment in the bed, make sure that, especially if it's like a skeletal traction where there's pins in the bone, make sure they're in good alignment. Neurovascular checks, what are those? What would we assess if we have a patient in traction? What's so important? Pulses, circulation, swelling, color, pain, compartment syndrome. Yes. What is it? Pallor, pain, paresthesia. If y'all see that word ever mentioned, paresthesia. It's like a weird sensation. It can be tingling, numbing. It's kind of an umbrella term for just a weird feeling, but it's not pain. So paresthesia is like numbing, tingling, numbness, something different than pain. Okay? If you see paresthesia. Pulselessness, pain, pallor, all those are signs of compartment syndrome. So keep an eye on that. Skin traction, we're just using straps, okay? This is Bryant over here. I always remember Bryant has his feet up in the air. I remember that. So we might have a femur fracture. So why do we use traction? What's the goal of traction?
To keep the bones aligned, right?
Okay.
Proper alignment.
Immobilize. So that bone can heal. That's why the muscle withers away to nothing. There's no muscle mass because they've been immobilized. So that muscle is there, but it's atrophied. You got to immobilize to get the healing to occur. And this is Buck's traction down here. Both are skin tractions. Skin traction You're gonna do lots of skincare assessments because we got straps and we're pulling. So we're gonna look for redness, skin, signs and symptoms of breakdown. Make sure that there's no twisting or buckling with the straps, that they're all nice and smooth, okay? So you see skin traction, think skin assessment is gonna be priority. Skeletal, we got pins in the bone. What's a main concern?
Infection.
Yes, because we've got a breakdown in skin integrity. So the skin is open, we got a pin in the bone. That's going to cause high risk. I've got a lemon seed in my straw that won't come out. Put something in there to get it out. Pain relief, alignment again is also going to be important, whether it's skin or skeletal. Make sure they have proper alignment. Pin care, assess the pin site. Is it red? Is there purulent or pus draining out? Is it warm to touch? Is there an odor? All high risk for signs and symptoms of infection. So we're going to watch that. Osteomyelitis can result from skeletal traction, so infection in the bone. You got to watch that. Think about how hard it would be to care for a preschool or a school ager or any child for that matter in traction. Do you think they want to be in the bed? You're going to have to be creative and think of things and games and books and video games and music and whatever you can do to keep them occupied because they are bedfast, basically. And this is everything we just talked about. Fasciotomy is an opening in the muscle when we identify compartment syndrome to allow that pressure to reduce. So that's how they address that. Same thing with our kids with the cast. We're going to watch the capillary refill. Are the fingers the same color as the arm that's not in a cast? Are they warm? Are they swollen? Don't hang the cast down low. You always got to keep the cast elevated, okay, on a pillow. Can they move their toes? Can they move their fingers? The main thing I want y'all to know about a fiber cast or a plaster cast is when it is applied, it's wet, you have to handle the cast with the palms of your hands, not fingertips, because you will cause indentations in the cast when it dries, which will cause skin breakdown and wounds inside. So you have to hold the cast like this, not like this on a plaster cast. A lot of people though are going to these other kind of synthetic materials, and that's not an issue. Who had a broken something in here before? Yeah. Who did you break? Left arm. Being stupid. My daughter broke her arm. That's both of them.
How do they spell their name? Is it in a group?
Super active and
They is Data and Michaela just in a group?
I think I added everybody to that group.
Check that's how they spell their name. I'll make sure that's
Can you put anything down inside the cat
No, my
Okay.
stuff is there.
Can you put anything on the calves if it starts itching?
There's
And it is the worst itching ever. Yeah. What can you do for the itching?
Suck it up and gravel.
Yes, Benadryl, you can try that. Taking a hair dryer and putting it like on a cool setting and putting it right on the spot might help a little bit. Don't put warm because if you're itchy and you add warmth, it's going to get itchier. But you can try that. So we take that cast off, we're going to see scaly skin, right? We're going to do your skin care, exfoliate, not take the scabs off. Make sure we're using good lotion. Explain to the child, this arm is going to teach them before you take it off, because they will freak out when they see all that.
Stinks.
Yes, it does. Sweat, skin cells, any cuts or lacerations have to be addressed prior to putting the cast on, so maybe they have a scab in there too, that's had, blood that's dried.
I was little and I still remember that smell. It smelled like belly button and butt.
It is nasty.
That's butt belly.
And all that and worse. They have to,
Thanks.
so if there is a laceration, they're gonna clean it, they're gonna, probably put a glue on there, not a stitch, depending on if it was a dissolvable. But they have to address that and allow that to start healing before you might have a temporary, like sling. Then put the long-term cast on, because that's usually on about 6 weeks. I've already mentioned this, osteomyelitis, bone infection, break it down, osteomyelitis, or inflammation of the bone. Could be from a really bad impetigo infection, which we just talked about last week, okay, that was not addressed, and now it's in the cellulitis and then osteomyelitis. That's pretty rare, but it could happen. Surgical contamination, had some kind of surgery that now we have a secondary infection. Osteomyelitis is not penicillin for 10 days and go to your house. This is IV antibiotics for a long time. Significant infection.
Mhm.
And they should do a blood culture to find out what the organism is, just so we pick the right antibiotic, right? We always do culture and sensitivity anytime there's an infection. We don't want to just pick a random antibiotic. We want to know it works. We're going to watch labs. Muscular dystrophy is a sex-linked, which means it's passed down to male children. It's really sad because they start out normal, and over time they start showing weird signs and symptoms: muscular tripping, falling. Their calf muscles get really, really enlarged, but yet they're showing like that they're very weak. They have these big calf muscles. Developmental delay, so they were progressing, then all of a sudden, bam, they stop progressing. They actually start regressing in a lot of cases. By the time they're hit school age, they're in a wheelchair. They do have cardiac abnormalities that go along with this condition, and they do not live as long of a life as those that don't have muscular dystrophy.
Right here where it says the bodybuilders take the phosphokinase, the enzyme.
Yes, creatine phosphokinase, yes.
That's a good thing. Why would bodybuilders take it if it's making them weak?
You hear about people taking creatine, like bodybuilders and stuff,
That's
to
creatine.
build muscle, okay, as a supplement. These kids show increased creatine in their blood just normal without a supplement.
So that
And it makes them, I guess I'm trying to figure out, why does it make them, if bodybuilders taking it, it should make them stronger, but you're saying they're getting bigger
Hypertrophies the
muscles.
muscles.
Oh, so it can look big. Okay, all right.
Makes them buff.
Okay.
Yeah.
Just want to look, it pumps it up, but doesn't really make it stronger.
DMD is, yes, it's this. So cerebral palsy, just write CP next to it if you're doing flashcards. This, put DMD, but I'm going to spell it out. Or I may say both. Cerebral palsy / CP. Okay.
Can you go back up?
Yeah.
That's how they move, that's how they start to move.
Yeah. Sorry, I
Oh,
did
those
not
dudes.
realize I skipped. Yes. They are on long-term steroids. they lose a lot of their muscle mass over time and end up in a wheelchair.
But nothing happens to, like, they still, I mean, right,
It's, yes,
So what happens to their heart? Because it's a muscle.
cardio, you didn't see this up here, they do have cardiomyopathy.
Oh no, I was still over there on
That's
signs
okay.
and
No, but I like the way you're thinking, that's good critical thinking ability. Absolutely, it's a muscular issue, that is a muscle. Probably why their lifespan is short, it's a heart thing, it's not the leg thing.
then it got weaker and weaker and stopped pumping.
That's
There you
it.
go. Okay.
Again, can't fix the problem, we're gonna just try to give them the best quality of life. What can we do? You know, can we get you in therapy? Can we do range of motion exercises? You know, keep them stimulated intellectually, still take them to school and do all those things.
So do they have high protein diets and does that help at all?
Anytime-
This is crazy. I mean, that's not crazy, it's sad.
Anytime you have a child, just think about an immobile person, how it may, the nutritional challenges that you're gonna be faced, right? So they're gonna probably struggle with more constipation because they're not moving, right? Their
Mhm.
bones are gonna be more brittle because they're not moving.
Mm-hmm.
We're gonna try to correct some of that with diet supplements and stuff to kind of help, but if they're not weight bearing, is it ever really gonna be fixed? Probably not. We just wanna minimize, side effects or extra long-term, side effects from all that.
That's horrible.
Okay, we're gonna talk a little bit about, cancer,
Sarcoma.
and these are the only two that you have to study, okay? These two. Osteosarcoma, if you've heard about these teenagers that are running track and they fall and break their leg and they take them to do an x-ray and they find a tumor in one of their long bones, that's osteosarcoma. Y'all probably heard about this in the news.
Yeah, the teacher had her son almost died.
It's in typically the femur,
Yeah.
but it's not detected, slow growing and not detected till they break the bone. Then they see it on x-ray.
Dang.
Why is that?
It is a-
hiding in the body?
It is inside the bone and it's very, very, very slow growing and it's been there for a long time.
No side effects.
Defined till
So
it
the
till an
bone was
injury.
never broken, they would never.
These are kind I think they need to have. I know CPS workers aren't like medical workers, but they need to train them and stuff like this because I had a little cousin she was fine and she just stopped walking. And they had CPS case open thinking somebody was abusing her and everything the whole time she had cancer in her bone. But she wasn't old though. She was
They
little.
should always rule out medical stuff before they start thinking about all the.
They went straight to
social
abuse.
stuff.
They was like, for this type of break, she had to be abused.
Did you work for CPS?
Mm-mm.
You just have a lot of experience with, because
Mhm.
you've mentioned other cases.
Yeah, and I was on the other end. My daughter went for UTI. Yeah.
Oh, that's right.
Yeah.
So the difference is, that one is bone marrow and one is of the actual bone.
Correct.
Yeah. Some of this need to be taught.
sarcoma is the name of the.
Tumor, the type of tumor. So if you break this, it's like bone cancer. And Ewing's is in the marrow. Typically, Ewing's has a poorer prognosis because it's in the marrow, and you know we have bone marrow in a lot of places, right? Not just this one. They may find it in that one leg. They're going to do amputation, which is sad.
Can you help us remember Ewing's? Osteosarcoma, I can break that down, know that. Ewing's, what?
Ewing.
Ewing's?
All I'm thinking is Patrick Ewing. Basketball player, but that doesn't count.
Think about how tall he is, long bones.
Yeah, true.
That's true. That's true.
Yeah.
Thank myself.
Yeah.
My old players that I used to watch.
Ewing's, Patrick Ewing.
So it says no
Do
surgery.
a flashcard
How they came up with that name? Jesus.
Probably the Dr. Ewing years ago was one.
Discovered it.
There you go. 1921? Oh my gosh, there you go, Dr. James Ewing, 1921, 100 years ago.
Okay.
Fabulous. There you go.
Got it. Okay. Good prognosis. If no,
No surgery because it's in the marrow, chemo and radiation though. So the other one, like I said, most likely is going to be an amputation and then treatment because there's cancer in the bone, there's highly likelihood of metastasis. So that kid's going to have that leg amputated and treated to prevent metastasis or treat metastasis, I should say. Whereas Ewing's no surgery, just radiation and chemo.
Oh, wait a minute, you say amputation for which one?
The one think about the bone. Remember, it's in the bone. It's been slow growing for a long time. They will have an amputation done on that side to remove the source.
So which one is that one? That's for the
osteo.
So, remember, injured, slow-growing bone tumor, identified typically in a break, has been there a long time, amputation, radiation, chemotherapy. Ewing's, no amputation because it's not in the bone, it's in the marrow, and it's going to be treated with chemo and radiation only, not amputation. You're welcome. And obviously we talked about x-rays. We're going to pick up stuff that is bone related on an x-ray, right? So you would see this osteosarcoma on an x-ray, including the break. Okay. I know y'all learned about rheumatoid arthritis, but this is juvenile idiopathic arthritis. It used to be called JRA, but now it's JIA, juvenile idiopathic. It is almost 100% like rheumatoid arthritis, like your little old ladies that are in the nursing home that have their hands all twisted and those big knuckles and the inflammation and the pain and stiffness, and taking all those steroids because remember it's an autoimmune disease, so they're on high doses of steroids. This is the same thing, it's just in the pediatric population. So don't overthink this. You see this go, this is like the rheumatoid arthritis lady, not the osteoarthritis, the rheumatoid, the one that has the steroids maybe on those once a month injections like Remicade and all that. And, you know, the difference between osteo is just like the old people stuff. Rheumatoid is the autoimmune where it's multiple joints. They may have organ involvement. It's an autoimmune condition. And you have 20-year-olds with rheumatoid arthritis. So
We need to know that oligo is like the eye, inflammation of the eye, like things like that? Or?
I do want you to know that if they have JIA, they need to be seen by ophthalmology.
Okay.
Some of the medications that they take can affect the eye negatively, so we want to keep an eye on their eyes. Say that, write that on your flashcard. Keep an eye on their eyes. But I don't want you to study this. I mean, you can break down the word to figure it out, but I'm just trying to help y'all minimize on how much you try to ingest.
You said ophthalmologist? Thank you for that.
You're welcome.
Okay.
Hi, doctor. Anytime you hear autoimmune, think steroids. And when we when we give them steroids, they're going to be at risk for what?
infection.
because we've lowered their resistance to treat their illness.
Plus higher, blood sugar.
Yes, definitely. High doses of anti-inflammatories or NSAIDs, non-steroidal anti-inflammatory drugs. So naproxen, Celebrex, plus your steroids. Methotrexate, I just want to make a point here, is actually a chemotherapy agent, but some people with severe JIA benefit from methotrexate to control their symptoms. PTOT, minimize joint deformity. They may be wearing splints, wrist splints at night, ankle splints to keep them aligned. Okay, so we're gonna do all that. Would we apply warm or ice on these kids' joints?
Warm.
Yes, good. Warm is gonna help with pain control and it's gonna increase blood supply to the area. So when you think arthritis, think warm, not cold. How it is diagnosed, you may have a kid that has multiple times where they have a fever and they go to the doctor and they can't find anything wrong with them. They start having arthritis in certain joints for a significant appearance of time. They will take them for some blood work and usually get the diagnosis like that. So. Already talked about splints. I talked about heat. Exercise, even when they have a flare-up or an exacerbation, we want them moving. So versus the osteo guys, you know, they don't want to move. These rheumatoid or the JIA folks, the movement actually helps their symptoms. So we want them moving.
Those are the ones that are worse in the morning, right? Because they haven't moved all night.
I don't know the time of the day when it is the most painful, but could be, I'm not sure. I won't know that one. Range of motion swimming, we've already talked about swimming pool. A lot of these musculoskeletal conditions, they do better if they can get into the pool, use their arms and legs and have that weight resistance. We want them to be able to perform their ADLs. That's bottom line. They're going to have this condition, but what can we do to minimize flare-ups, not cause joint deformity, to where they can have a normal life with minimal interference from deformities or other issues that they've had from just being on all these meds, which that's how they treat the condition, unfortunately. But steroids, think infection. Okay. Scoliosis, this is a great slide. We do not do surgical correction until they are a 40 or a 45% curve, which is huge. This is, I don't know, this is close. So for you girls out there, do you remember going to gym and bending over and then checking your whole shoulder height, your scapula, your hips?
But there's two types, right? There's one with the spine and then like one like with your shoulder, like one side is higher than the other.
Yes, you check shoulder height, you check the scapular area in the back, check the hips, then you have them lean over and you check like the thoracic cage. It should be the same, not like this.
What if one shoulder is higher than the other? Everything else is normal.
We watch that.
That's what they told me. So I was
You
like,
never
one of my
know.
shoulders was a little higher than the other, and I was like, okay.
Yeah.
Like,
Until they have 45%?
45 degree.
45 degree.
Now, if you were at I don't know what your book says, I'm not going to give a specific number, and I'm not going to ask you a number on the test, but before 45, we still got to do stuff. We're going to be watching them. We're going to be measuring curvatures. We're going to be having them do core exercises, strengthening exercises, PT do what we can to reduce, further curvature. They may be in a brace for a while. But it sounds like if you only just had the shoulder discrepancy, that it was really mild. I couldn't tell
Yeah,
you what the
that's why I
percentage.
never even got treatment. And how about treatment spine? On the right side.
You do?
I didn't
Do they? So obviously so up and through till puberty is finished, that's when you're gonna notice all that. So that's why I try to identify those girls going through their growth spurt.
Is it hurt? You're back here. It hurts like,
Does it? You better, hopefully you don't have to lift a bunch of people in your area you decide to work in.
So what causes
I'm gonna
scoliosis?
call Matt. I'm
I
gonna do
didn't do that.
I'm gonna call Travis.
It is, it can be genetic. You know, so I'm taking my RN students over here to Odyssey Academy on Thursdays to do their screenings because the nurse that is the district nurse, she's over all 3 campuses, Galveston, Webster, and Texas City. She just has so many kids and she can't do them all. So there was this one girl that walked in last week, and I was like, I don't even have to check her back. I knew I was gonna find something, because 5th graders they're all sizes and shapes, right? You got the ones that hadn't done anything yet, you got some that are doing stuff, and then some that are like really doing stuff, as far as growing.
Oh, I was
You know?
like,
I was like,
What are we talking about?
development.
What are we
Yeah.
talking about?
Development, sorry.
in 5th grade?
So, they're going through their puberty change, you know?
Okay.
But anyway, she walked in super duper duper tall, so she's already got some kind of a growth spurt. And sure enough, she had 2 markers were abnormal. Shoulder, I think it was the shoulder and scapula was off. But, yeah, I knew I was gonna find something on her. But, yeah. Rib hump, that's when they lean over and dangle their arms, we're gonna check that. There are other conditions, like kids that sit around like this, that cause like functional, but their spine's really intact and straight. It's just their posture and the way that they're holding themselves. So, again, we're gonna state mandated screening, vision, hearing, and spinals to pick up on these kids that are.
It's okay to pop your bag, right?
Yeah.
Okay. Alright.
Obviously, you're gonna pick this up on X-ray. Here's a picture of a brace. There's your numbers, y'all. Up to 20 degrees, you're gonna watch, monitor, follow up. 20 to 40, bracing. Look how often they have to wear the brace. A minimum of 16 hours a day.
So they only take it off when they sleep?
Not even
When they're showering, right?
Shower. Because really, technically, don't you want to wear it more than the minimum so you get the more effect,
I was
better
just
effect
thinking
as
it
much
would
as
be
you
hard to
can?
sleep in that, you know?
You're gonna have to get used to it. 45-degree spinal fusion is the term for the correction for the surgery. Remember, just like all of our other neuro and muscular effects, we're gonna watch those pulses, circulation, warmth, all that, pain control, skin care, log rolling. This is what they put in their spine. Look at that. It's called a Harrington rod. You gotta be real careful when these girls are in the bed. You gotta roll them like a log, like they teach y'all in skills or foundations, how to log roll. That's how we position change these kids. Remember, lots of fluid, lots of fiber, immobile. You gotta think about the GI tract. All the issues being immobile affects every system. And once they get all straightened up, their height changes 1 to 2 inches. It's crazy. I think we're almost done. Obviously, you want to advocate for helmets, whether they're skateboarding, bicycling, whatever. Elbow pads, knee pads. Remember how I beat that into death. Safety. If you see any question on a test or HESI or NCLEX that has to do with kids, the first thing is, especially educating parents, is safety. Keep the kid safe at all costs. That should be all. Understandable
Okay.
information.
No problem. Go ahead.
And obviously, if we ever see an injury and we get the story from the caregiver and it doesn't sync up, it's your duty to make a referral to CPS. They pick up on other things. Remember, neglect is a form of abuse. So it's not just the bruises and the broken bones and all the other stuff. It's other things you may be picking up on. Maybe they don't have a PCP, they just kind of go to urgent cares and places like that to get health care so that they don't have that continuity of care because they don't want it.